I'm Dr. Amy Beta, Director of the BSN program here at the Francis Payne Bolton School of Nursing, and affectionately known as FPB, and that's the only time I'm going to say it, so you probably have heard it 1,000 times, and that way I don't have to say Francis Payne Bolton School of Nursing at Case Western Reserve University 50 times in the next 3 minutes. Okay, so it's almost been a month since you've completed Prepare to Care, orientation in your BLS training. You've had two and a half weeks of classes, maybe a quiz already, and now you'll be starting your clinicals in the hospital setting. Next week, you're going to see real patients, real families, and real illness, and often, but not always, real recoveries. So the nursing thing's starting to get real for you guys, okay? This is a point where your college experience starts to become very different from your roommates and friends that you've made on campus. First, all your pre-med friends will start wondering if they should switch to nursing because they probably won't touch another patient for 5 to 6 years. And at the same time, your friends who are going to be future engineers and writers and attorneys are spending their days sitting at a desk, sitting at a computer, or in a lab somewhere. Your college experience is different because nursing students are the lucky few whose classroom includes the patient's personal space, their personal lives, and the lives of their families, and not necessarily when they're healthy, but when they have a physical or mental illness, when they are in pain, when they had surgery, and when they die. You will have a completely different focus and awareness than your roommates and friends. This is an incredible learning opportunity for you and a very unique experience. But it's also a privilege. And with that privilege comes responsibility and accountability. Responsibility to your patients and their families, and accountability to yourself and to the profession of nursing. Now, I know that's asking a lot for most of you who just completed high school in the last 6 months. So don't get me wrong, you can still have a lot of fun on campus. When you're a college student, we won't go there and tell stories about any of the faculty. But when you put that uniform on, when you use that stethoscope, your stethoscope is an extension of you, literally. Now, the stethoscope was invented in 1816 in Paris by Dr. Leray Laennec because he was uncomfortable placing his head on a woman's chest to listen to her heart rate. So out of modesty and respect for the patient, he created the stethoscope. And basically what it was just a wooden tube. But he still made it a personal connection to the patient and gave her some dignity. The stethoscope ceremony is a way to remind you to tread lightly, respectfully, and with purpose in this very unique learning environment. It's also important to remind you that part of learning to help others is learning to help yourselves. Ask questions when you don't understand. Go to your advisor when you have a concern. We, your professors, your clinical instructors, your advisors, we are all here to help you to become great nurses and future leaders in the nursing profession. So today is one of the many first steps we'll take together in that journey. Best of luck, and thank you. Now I would like to introduce Professor Lorene Gagowski, who is an advisor to many of the first-year students here, and will talk with you about today's ceremony.
Good afternoon. I'm very privileged to be speaking to you today. And as Dr. Beta said, I wanted to talk about why we have a ceremony like this. This is actually the 4th annual stethoscope ceremony. And as you know, ceremonies like weddings or birthdays are used to mark a milestone in our lives. Nurses have historically had ceremonies to mark important points in their professional formation. But today's ritual formalizes an educational milestone for you. The Francis Payne Bolton School of Nursing class of 2021 has met the requirements to participate in patient care in the hospital. As Dr. Beta said, we recognize the hours of preparation to reach this point. As she said, you'll finally get to use your stethoscope with real patients and enter their personal space. And patients trust you because they see the stethoscope, they see your uniform, and they trust nurses. If you think of this moment, if you've heard the term liminal space, so metaphorically, it's like you're standing in a doorway right now, and you're kind of are walking from the space that you're in now as kind of a non-nurse and stepping over that space into a very responsible position. You may feel that some change, as Dr. Beta was saying, you're going to have more responsibility than some of your classmates in other fields. And there is a certain feeling of separateness. You're a little maybe having experiences that your other friends back home or your parents don't have, and so there is a feeling of separateness. But eventually, as you take that step into the profession, you're going to be incorporated into the nursing profession. But I think this is a time, this rite of passage is a time for us to stop for a minute and either close your eyes or focus on one of the symbols that's here. You probably recognize one of the symbols of nursing is the oil lamp, which often Florence Nightingale is shown holding the lamp as a sign of knowledge and enlightenment and relieving suffering. And flowers always, to me, represent the delicate nature of our life and the beauty of human life. So if you just take a moment and focus on a symbol or close your eyes, try to put away your to-do list, try to put away your concerns about other things and just be in the moment. Think about what it took for you to be here today, the sacrifices that you've made, the commitment you've made to yourself and your family. So let's just think for a minute and relax. I hope that it's a moment that you remember, knowing that it is a privilege for you to be here. You have your health, you have the love and support of other people, you have the support and backing of all the faculty and your colleagues. So enjoy it. It's a very, very happy place to be. So I hope that you look forward to going to the other side of that space through the doorway as you begin your professional nursing journey. Congratulations.
Good afternoon. My name is Emma Baker, and I'm the current president of the Undergraduate Student Nurses Association here at CASE. 2 years ago, I sat in your same position, watching that year's president give her speech. I never thought I would be the one giving the speech. However, I have learned something amazing through my time so far at Case Western and the nursing school, and that is you can do anything you put your mind to here. Yes, this may sound cheesy, but it's true. I want you to look around at your peers and the faculty in this room. Everyone here will support you through your journey through nursing school in and outside of the classroom. I would not be standing on the stage without my classmates or the faculty here today. I have never felt so supported than I do when I walk into the nursing school every day. You are all going through this together. If you are struggling through a class or just want to get to know someone better, don't be afraid to send that text or Facebook message. Don't be afraid to put yourself out there. Don't be afraid to email your professor and say that you don't understand. Don't be afraid to take advantage of opportunities in clinical. Take a chance. Either way, you will learn something from it. And hopefully you will feel the sense of community and support that I have. What does this all have to do with why we are all here today? Well, something that people don't normally relate to stethoscope is that it connects people both literally and figuratively. Today, it will connect you with your peers. Today, you take one step forward with them. Maybe use it today to reach out to someone in your class. In the next coming weeks, it will connect you to your patients. You will use the stethoscope to listen to your patient's lung sounds or heartbeat. This will provide you with assessment data that gives you more information on your patient's condition. This can start a conversation with your patient that soon becomes a connection. This connection between a patient and a nurse is one of the best things about nursing, at least to me. Patients will value that you are able to take the extra time to talk to them, especially as a student. I said before not to be afraid to reach out to your peers, and the same goes for your patients. Don't be afraid to reach out to them because they may be too afraid to reach out to you. This stethoscope will not only connect you to your peers and your patients, but also periods of time in your life. I hope that you can look back on this day and remember why you went into nursing. Let the stethoscope be that reminder, and let it remind you of all the good times that will continue to happen throughout nursing school and your nursing career. Congratulations, and I wish you the best of luck in the upcoming years.
Well, good afternoon. Hi. I am really pleased to be here and really to be talking to so many future nurses. I'm a practicing nurse of 46 years, and I love nursing, and I have the deepest respect and appreciation for nurses. So this ceremony is really important because you're now entering into the clinical experiences with real patients and real families, so that you can apply the knowledge and the skill that you're learning into practice. FPB is unique in many ways, but in terms of the BSN program, I think it's one of the few in the country that introduces nurses to clinical experiences within the first couple weeks of their freshman year. Usually, places wait until the second year and sometimes finish all the liberal arts and then we start. But we believe here that your learning is enhanced by introducing you to patient care so early that the knowledge that you're taking in, you have a frame of reference of why you're learning this and what it means to your patients. It also gives you more time to develop in the art of nursing, which is that connection to patients, and to develop both psychologically, emotionally, and interpersonally. So next week, you leave the school and you enter the land of the sick. So says Susan Sontag in her metaphor on illness. Illness is the night side of life, a more onerous citizenship. Everyone who is born holds dual citizenship, one to the kingdom of the well and the other to the kingdom of the sick. Although we all prefer to only use that good passport, sooner or later, each of us is obliged, at least in some way, to identify ourselves as a citizen of the kingdom of the sick. And within that kingdom of the sick is the nurse. The nurse enters into one's life at the most vulnerable times. A time of birth, a time of injury, a time of illness, and a time of death. And what does a person need at times like that? They need to feel safe. They need to feel trust. Trust in your competency and your knowledge, but also that you care, that you understand what it means to them to be in this place, and that you will advocate for them, and you won't judge them because you care. As a nurse, you have such capacity to give, to learn, and to receive. It is a maturing experience to be exposed to and to share in the joys and the pain of life. You're going to carry those feelings with you as you leave the clinical areas and your patients. You go back home, you go back to the dorm, but they're with you, and they will change your lives. You will also learn that that connection that you have with others, that humans need that. They need your presence as a nurse. And that one of the most important interventions that you can ever give is learning to hold and to comfort. As you enter these clinicals, it's normal to feel a little anxious. I remember my very first clinicals, and you're going to remember yours also. I remember my first assignment of a patient. This patient had stage 4 liver disease. She was asleep when I entered the room. I went to take her vital signs and her blood pressure, and I couldn't hear anything. And my heart started racing, and I tried it again. And I felt at my shoulder my clinical instructor, and she tapped me on the shoulder and said, "You might want to put the tips of the stethoscope in your ears." Now, you're not going to have to worry about that because you have Dynamaps, and they will read it for you. I do remember my very first bath was an elderly patient with a stroke. I remember how careful I was in lifting the arm and the leg on the left side, which were totally paralyzed, and how heavy they were, and thinking to myself how this man's life has changed forever. I remember giving my very first IM injection and pulling back that plunger on the syringe, hoping there wasn't blood in it, and then I wouldn't hurt the patient. And I remember changing my first abdominal dressing. And this wasn't in the first couple weeks, but it's a memory that stays with me. I was sitting on a surgical unit. I was assigned to my one patient. And I knew this patient had a dressing change. So I was going through the chart very intently so I'd know what I had to take in the room, how to go through the procedure. My instructor, of course, would be with me. And all of a sudden I heard on the unit some humming. Dun, 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 dun. This was a surgical unit. And that was what the nurses did when the chief came to the floor. And everybody scattered. Everybody went away from the desk, the nurses, because he was a bear, and he really dressed you down. And he looked up for his patient, and then he called out my name. I looked around for my instructor. No one was there. So I grabbed the supplies, and I followed him down the hallway. And then I heard, dun, 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 dun. So then I know that he knows what we were all doing. Now I'm really scared going into this room. But what he did as soon as he entered the room, he introduced himself to the patient and he introduced me. He explained that he would be teaching me how to change this dressing and what he would be doing. And he did it in a very gentle way. He taught me, as well as the patient, how to look for signs and symptoms of infection, the granulation and the healing of the wound, how to irrigate the wound. And as I left, besides learning all of that, I also learned that it is so important, the relationship between doctors and nurses. and how when those are solid relationships, how that serves the patient well, and you don't have to be afraid of them. I also remember my very first death of a patient. It was in the middle of the night. We did clinicals on night shift. And again, I went to take the vital signs, and this time this patient was not breathing. And I hit the code button, and everybody came in, and they could not save her. It was my instructor was there to support me through that, to help me learn how to bathe the patient and prepare the body for the family. These are just some stories, and you will have stories, and you will remember them, and it's important to share them. It's all part of learning to be a nurse. And I close with a story from a nurse. Her name is Courtney Davis. She talks about the other side of illness. My brief illness allowed me to look at my nursing role from another vantage point. All along, I have known how we caregivers, we nurses, move in and out of a patient's grief or happiness, changing our expressions, lowering our voices, going from one room that is blessed to another room that's as cold as January. Patients sink into our care wholly and confidently. They let us carry them. They come to know us, not the details of our lives, but the intent of our souls. As we come to know their secrets. Today, when I stand at a patient's bedside, I see my actions through their eyes. And the sense that my illness is wavering lingers with me. Pay attention, nurse, it says. What you do and who you are when you are with a patient is significant. Your presence etches the chapter into the lives of that patient's life that can never be erased. And I have total confidence that the memories patients will have from all of you will be memories of kindness, support, and gratitude. Congratulations in receiving the stethoscope, and have wonderful clinical experiences. Thank you.
Okay, thank you, Ms. Koppelman, for your kind words. I believe that during your experience here as a student, you'll get to know more and see Ms. Koppelman around, as she is actually very engaged with the student experience here on campus. I'm Beverly Capper. I'm the Assistant Director of the BSN program, and I welcome you here today. And I'm very honored to be on stage with your advisees, Kathy Money and Lorraine Gaikowski. And they will be presenting your stethoscopes to you. Little housekeeping before you start, so we can do this. We're going to do this half of the auditorium as you come up. The usher will come down to your row and get you. Please bring your name card that was on your seat with you. And as you come up through, you'll come across the stage and hand me the card. And as I read your name, you'll be presented with your stethoscope, and then you can return back to your seat. We do ask that you refrain kind of from walking in the center aisle here, as we are trying to broadcast this to your parents through a live stream. And that way it won't block the camera so much. Thank you. Ashley Ayumada. Megan Arumpanel. Mira Amin. Chloe Bayless. Najwara Basalara. Okay. Cyan Bose. Catherine Broderick. Z Bud. Thank you. Abigail Bukovinsky. Emma Kane. Dina Cascarano. Christopher Seminara. Benjamin Chase. Yeah. Helen Chen. Sue Chen. Ashlyn Cummins. Nicole DeCanzo. Oops, sorry. Haley Devine. Kippy Douglas. Caroline Dufenauer. I hope I got that right. Abby Dungan. Sorry, I think I got that wrong, right? Naomi Epan. Jordan El Hindi. Thank you. Jasmine Floyd. James Frothergill. Let's go. Jacqueline Corby. Jillian Gossard. Devin Grew. Karina Guevara. Julie Hines. Madison Hirschfeld. Azrae Hood. Sorry. Kana Jung. Brady Jensick. Jayana Jader. Megan Johnson. Jessica Camus. Alyssa Cato. Samantha Keltz. Riley Kenahan. You guys are testing me. Esther Kim. Maya Kirk. Judy Coe. Thank you. Katarina Kai. Go ahead. Go ahead. Olivia LaRouche. Caitlin Ledford. Joanna Lee. Hannah Leff. Caroline Lee. Jenna Litzy. Kendra Mayo. Kelly McCarthy Mallet. Emma McNally. Adrian Meek. Kayla Miller. Kim Muckenschnauer. Sorry. Oh, I got it right? Oh. All right. Oh, dear. Heidi Nugar. Fong Nguyen. Iripan Antaveras. Madeline Pelosi. Eunice Park. Alyssa Patterson. Emily Paulson. Sarah Razor. Hannah Robinson. Michelle Rodriguez. Sophia Schuler. Angelina Scribano. Oh, sorry. Paul Swirsky. Reagan Thibault. Aaron Wepner. Grace Shee. Allison Yu. Emily Zhang. Jessica Zhao. Xingyu Ju. Thank you. Sorry. Amy Sussman. That's it? Is that it? Yay. All right. Thank you. Congratulations.
I'm going to put up the Nightingale Pledge that we'll all recite together. It's going to come up on the screen, but since I'm very technologically challenged, I will do my best, but Professor Capper will help me with it. So if we all say together, I solemnly promise before all present to live my life honorably and morally and to practice my nursing profession faithfully. I will never intentionally harm anyone in my care and will work hard to practice nursing safely. I will never take or knowingly administer any harmful drug or therapy. I will do all in my power to maintain and elevate the standard of my profession. By active engagement, a commitment to caring, continuing education, and mentorship of new nurses and nursing students. I will keep all health and personal information of patients and families confidential as I practice my calling. And I will work collaboratively and respectfully with all healthcare providers and devote myself to the welfare of those in my care. Good luck and best wishes. And now Professor Capper is going to give you some directions to the event that's set up for you through first-year experience across campus at the corner alley, but she's going to give you the directions. I still get lost.
All right, thank you. Congratulations. You'll notice that you have different colors stethoscopes. Tradition is that you can change and swap and do that among your peers, but we ask you to do that during the celebration at the corner alley. As you leave the room today, some of the upperclassmen have joined us in the atrium here in this building, and they will have a sign with a color on it. The color represents your color of your stethoscope. Please join them, and they will be leading you over to the corner alley. The first-year experience has graciously offered us the opportunity to gather there with some bowling. We have 10 lanes reserved for bowling and some great snacks to enjoy in. So if you'll congregate out in the lobby, we'll have some time to get according to the color of your stethoscope. Thank you.